Hi, everyone. Autism Spectrum Disorder. What is it and why do we need to know about it? I'm Cynthia Demos. This is Here's to Health. We are speaking with Dr. Agatha Morello, who is a licensed clinical psychologist with South Florida Integrative Medicine in South Florida, of course. So, doctor, go ahead and start right there. What is autism spectrum disorder?
Thank you, Cynthia. So autism spectrum really is a neurodevelopmental disorder that's characterized by difficulties in social communication and also has some restricted repetitive behaviors and interests. So we're seeing kiddos and individuals who are struggling with things like back and forth conversation. They're struggling in their day-to-day interacting with others. And then they also have some either repetitive behaviors or sensory seeking behaviors.
And how do you define how or where they are on the spectrum? Is there a number? Is there like, oh, he's a 1, a 2, a 10? How is it defined?
Sure. So it's called a spectrum now because it's basically included the diagnosis that used to be pervasive developmental disorder and Asperger's all into one. And when you diagnose, you end up looking at the level of support that the individual needs. So depending on how many behaviors and characteristics that they're coming up with on these two categories of social deficits and restricted repetitive behaviors, you give them a level of support, and that's where you see where they land on the autism spectrum.
Okay, that makes sense. That makes sense. And what are some red flags to look out for?
So you definitely want to look out for in little kiddos, are they orienting to their name, right? So when we're calling little Timmy, is little Timmy turning his body and making eye contact with me, right? You want to see if little Timmy is sharing and giving you things, showing interest in engaging with you. You also want to see if the individual is able to engage in pretend play, right? We usually see some struggles in that sense. And then obviously the repetitive motor movements, there may be hand flapping, some kind of stimming, and then sensory differences as well.
And so how do you obtain a diagnosis of autism spectrum disorder? How do you do that?
Yeah, so someone like myself who specializes in the assessment would be able to complete a developmental assessment that does the ADOS, which is the gold standard for diagnosing. It's an observation type of assessment where we pull for certain behaviors to see if the child demonstrates the behaviors that I just mentioned related to autism. We're also looking at their developmental functioning, right? Can they dress themselves, feed themselves? These are all questionnaires that the parents answer. And then we include interviews from school if they're in preschool or parents as well.
And why is it important to diagnose a child at an early age?
Well, Cynthia, right now, as of 2020, the CDC came out with an updated number. 1 in 54 children have autism. So the numbers are there. And what we're hoping for is that with earlier diagnosis, we can have earlier intervention, right? And provide access to things like speech therapy, occupational therapy, behavioral therapy, in order to provide the best resources for this individual to succeed.
Right. So you want to get them diagnosed early so you can start treatment as early as possible. Dr.
Yeah.
Agatha Morello with South Florida Integrative Medicine, thank you so much for joining us and giving us great insight. I'm Cynthia Demos, and this is Here's to Health.